Hello, everyone. Hope everybody is healthy and happy. Today, we will be reading a class. So let me share the screen with you. So I hope you can see. You can see the slides. So counseling psychology. So today is the class about counseling psychology, right? Hope the class would be the class would be something which you can benefit, and I hope this is interesting class for you. So this is the first week, the first week. So we will be reading the counseling psychology. So this class is prepared by Professor Mary Chow. So let's read and continue. So understanding counseling. What is counseling? We will be reading and understanding what's the concept of counseling, who can counsel, who can be counseling, and who can help the vulnerable ones and who are the affected ones. So we'll be trying for the sake of benefiting humanity, right? So let's dive deep to understanding counseling. What is counseling? Difficulty of justice, difficulty in justice, understanding human life and its difficulties, a definition that everyone can agree on in various ways on which human psychological changes can occur. An expert's perspective on human psychology can change times, right? And time basis. And general agreement on the definition of the counseling is what is this counseling? Or counseling is helping, actually counseling is helping the people or humanity in difficult psychological distress time. Whenever a person is counseling or consulting with a vulnerable one, with a person who is vulnerable to psychological aspects of human life and environmental issues, when another person is helping and giving choices to the person. So this is called counseling. And the elements of counseling, or the counselor, helper, a client, or recipient of the help. And counseling relationship, what is counseling relationship? A relationship between giver and receiver, right? So giver and receiver is called this matter, or between two, the situation or relationship between the giver of the counseling or consultation or the receiver. This process is entirely called counseling. Well, who is the counselor? Let's read. Who is the counselor? The counselor is a person who acts as a counselor or a consultant, giving choices to the vulnerable one, or a person who is in need of receiving information, listens well to others and consider their feelings as well, and gives the advice based on the rich life experiences, who has the knowledge, a concrete thought about the difficulties, and asking for help. The professional consultant. A professional consultant is a person who is giving good information, good advice to those who are in need. A person who has more potential to solve the psychological pain or difficulties of others, and also a person who can systematically learn and apply methods to help with the psychological difficulties. Understanding of counseling theory is understanding of the counseling method and counseling practice, experience or training based on the above two situations, right? As we said before, right now. Now, what are the goals? What are the purposes of counseling? The primary goal is the symptom relief or problem solving. The secondary goal, or the second goal of the counseling, is growth promotion of goal, or growth and promotion of mental health, or decreasing psychological distresses, and promoting the life experiences that a person is dealing with, right? And also the client restores the inner freedom, prepare for the anticipated difficulties after closing inspection of the case, after close inspection of the case, of the counseling, and conducted by the senior counselor. And counseling practice experience is a training. This is in training, right? Restructuring your personality to unlock your potential in order to avoid further problems or psychological distresses, and also in order to achieve the development in personal maturity. The entire process or the goals of the counseling is in order to promote one's difficult situation to be solved, and good life experiences. The qualities of a counselor. For example, we together, we're trying to be good counselors to the people while they are in distress, right? The professional qualities of a counselor, first of all, is understanding the counseling theory, role and function of counseling theory, that you can find the cause of difficulty. You can find the cause of difficulty. This is also the really important point. And it is possible to estimate the reality of the client situation. And it is possible to know the direction of the future consultation. The direction, first of all, you are analyzing the situation of the vulnerable person or a person who is in need. Then after that, you are trying to find the ways and which way or which potential are possible for this person, specific person, in order to avoid or promote the future problems, and to avoid the problems and promote a life situation. And the content of counseling theory is basic view of the human beings. And secondary goal is growth promotion of goal 1, right? And developmental process of abnormal behavior and psychopathology, specific ways to bring changes to the person's life, positive changes. Understanding of the counseling. Why we are reading counseling? So first of all, let's understand what the counseling is. The methods and the path to reaching the goal is called counseling and giving advice, as we said before. Can Moro go only to soul? This is a question, right? The right way, efficiency, or counseling process is required. And what were the initial difficulties, and how were they performed? The professional qualities of the counselor become trustworthy if the counselor is providing good information and good advice based on the situation analysis and one's abilities. Guide and agree on the progress of the consultation. So both can agree on guide and progress of the consultation. Specific attempts for medium-term changes, and also counseling process evaluation. When one is giving consultation to the vulnerable person, the counselor should analyze with himself that if these advices are proper for this specific person, and also prepare for the anticipated difficulties after closing the case. So we should analyze. First of all, we read what's counseling. Counseling is something when one is in difficulty, a person is in difficulty, also in psychological distress, depression or anxiety, whatever, and the person is dealing and struggling with the situation. And a counselor is a person who is providing enough good information or advice to the vulnerable person in order to stop further problems and move further in the proper way. Counseling practice is counseling practice and experience and training. The supervision and inspection of the case counseling conduct by a senior counselor, right? Understanding and correcting what went well and what went wrong. We as counselors, when we are providing consultation to our clients or those people who are in difficulty or psychological distress, we have to analyze with our mind, with ourselves, that what things are good, what things are wrong. which things are going well, which things are going wrong, in order to focus our attention to problem solving, a necessary course for both the counselor and client. And necessity of the counselor human qualities. Is it a problem or a human being? Is it a problem or is it a human being? The person who have difficulty is a human being. Yes, of course. A doctor who treats with poison, right? Who treats with poison. Is this which one is the problem? And also counselor as therapeutic tool. Counselor as therapeutic tool. It is definitely correct that counselor can be a therapeutic tool, can be considered, because he or she is trying to help others in order to solve their problems, as we said before. And client can go as much as he or she grows. The client can go further and he or she can face more problems in the future, but we have to be patient enough in order to provide good advice. And a counselor who is somewhat free from the difficulties that can be experienced as a human being. Second, the counselor as an example, the client's dependence on the counselor and the influence of the counselor's attitude and values in life. So here we are going and reading further. As counselors, we have to have good behavior in order to attract a vulnerable person or patient or client or the person who is facing with difficulty, right? So that he or she, our client, can give us enough information, and so that they can be open-minded to provide us information. And after reading the case, listening to them very well and analyzing their situation, we can provide enough good advice that they may help, that those information may help them in order to cope with the situation. Third, the human qualities of a counselor. First, self-understanding and acceptance. The person should be self-understanding and acceptable person, and having patience and listening, and a good listener, and also acknowledge your strength and weaknesses. First, as we said, understanding and acceptance. Second, acknowledge your strength and weaknesses. Respect yourself for who you are. Also, really important point. Respect yourself. We should be respecting ourselves, that who we are. We have to be open-minded at the same time, right? Real interest in others' lives, deep empathy and consideration for others, people's misfortunes or pain, and efforts to overcome the conflicts with others honestly. The person should be patient. The counselor should be a provider of sympathy or empathy with others, with the vulnerables, right? To make them open-minded, to tell you their situation so that you can help further and effectively. And seriousness and courage for life. Lessons and wisdom for mistakes and failures. When a person is coming and we are providing enough information for them, this situation should be lessons and wisdom for our future mistakes, or for their future mistakes, and also the courage from pain and frustration, willingness and effort to choose one's life, and recognition and responsibility for other choices. Counselor and the client, that both of them, they have a special relations. When a client is coming to the counselor, he or she is anticipating some situation that you may provide good information or good advice for them. So the reason for wanting or becoming a counselor, we will be reading healthy motivators, and acknowledge your strength and weaknesses, respect yourself for who you are, understanding acceptance, and unselfish desire to help others. This is the really important point. And like to take care of others, gaining strength from clients and who are striving for self-growth, wanting to share help and received through counseling. And also, this is clear, unwholesome motivators that need the need for superiority and wanting to be the savior of unhappy one or the unhappy one. The counselor are those who are the saviors of the unhappy ones or those who have lost their hope, taking comfort in seeing people less fortunate themselves. All of us trying to provide hope for others as counselors. And who is consulted? The client one, right? Who is consulted? Maybe the client is coming to the counselor, and who is consulted? Either the client or the counselor. Let's read about them. A person who is suffering from psychological difficulties due to various causes and trying to solve it through professional help. Yeah, through professional help. Physical difficulties and situational difficulties, and also personality difficulties can include all kind of distressful situation. Anyone with a problem can be consulted, right? Any person who has the problems, we can consult them. And if they ask our help, we can provide our honest help to them until the client comes to the counseling and until the problems are resolved. Clients who start counseling are courageous people. Exactly. That's why we have to respect them. And people who have responsibility or affection for their own lives, people who have desire to be or to get greater or to get better. Understanding the counseling. First, understanding counseling and what is counseling relationship. Consultation relationship in human-to-human meeting based on trust. And trust is counselor and the counselor's client. Trust in the counselor's client, and also bound in feeling connected, and also providing enough information or good information for the client. The client can also, the client will try to solve their own difficulties, but the client may have a desire to improve. They may have desire, or they will have desire, and the client has the power to solve the difficulties, and the clients will try to express their thoughts and feelings as honestly as possible, because this is their own situation. Trust in the client's counselors. The consultation relationship, and the counselor will try to understand and empathize with the difficulties, or with my difficulties, right? Or their own difficulties. Counselors will see me as I am, without judging or evaluating me. And this is the really important point, my brothers. So we have to understand, and we should not be judging them. We have to be helping them. We have to be working with them in order to overcome the problems, right? And as you can see in the scheme or in the schema, so both have relationship, the counselor and the receiver of the consultation. So we should be calmly listening to them and providing them with good information. We should not be judging them or evaluating them based on their situation, because the situation may be slightly different, and that would cause our clients to withhold their information with us, so we will not reach the good conclusion. Work alliance. What is work alliance? A relationship between a counselor and the client for successful counseling. And they're the three elements of working: a shared understanding that something will be experienced together in the relationship between or between the sense of the connection, and counselors and the client have common goals or tasks to solve the problem. Our main focus should be trying to help them. This is the first thing, and attaining their attention, gaining their trust on us, and working on the problems that they're suffering. There is an agreed goal between the counselor and the client. That is called the agreed goal. Both of them, they're working in order to solve the problem and move further. The consent to work, agree on how to proceed, consultationary or consultation, ways of work, priorities, and also approach as easy as possible. And also the frequency. You can see in this scheme, and this is the formation of the therapeutic relationship, the therapeutic relationship between the counselor and the client, right? And also a problem to be solved through counseling. Those problems should be analyzed through due course as we're reading that how can we help them, how we can help them, and is this a complete solution possible through counseling? There is no perfect solution, or the counselor cannot take over the life of the client. This is impossible, but we are just the helpers in order to provide good information or advice for them. We may not help them enough that much to the extent that we can solve the entire problems or the entire problem of the client completely, but at least we can try for the best of our ability. And it is up to the client to decide to accept the plan, Difficulties and causes of the client is also really important, and requiring counseling in marital discord or difficulties in heterosexual relationship, worries about the employment and career, difficulties in studies and learning, and problems in life and death. These can all cause mental situation or psychological distress. One may need help. And when you lose your loved one of your family or anyone who is close to you, one's feeling of loss, or they're feeling lost, right? And internet or TV addiction or alcohol dependence, emotional difficulties such as depression situation. The classification according to the passage of time and temporary difficulties. When the normal life adaptation functions can be performed within 1 or 2 month continuous difficulties, and when lasting more than 3 months, chronic difficulties, they're called chronic difficulties, and difficulties lasting more than several years are length of time and discomfort or severity of proportional. How much the severity is going to last and how much the severity has lasted that a person is coming to us. This is also a really important point in order to understand acute situation from the chronic situation. In acute situation, the situation may be handled very well and soon, but in chronic situation, it needs chronic approach, good approach, systematic approach in order to solve the problem and provide the client to a situation that he or she can be helped. And even if the present is temporary, it may become a problem later, and it is possible that temporary problems will become a problem again now. So we have to be curious about the time of the problem. Classification according to the location of the cause. Really important point, another really important point. Where is the cause of the problem? What is the cause of the problem and where is it located? The personal internal factors, is this personal or personality? Is this frustration, insomnia, depression, irritability due to sensitivity, or situational factors? What are the cause of the problems? Difficulties caused by external circumstances other than the client, example, domestic violence, disaster, job loss, bankruptcy, and death on an important person or the loved one. These are all the causes of the problems. It is difficult to clearly identify the source of the cause or source of the problem. For example, let's read an example. When a person avoids the person's because he experiences a lot of stress because of the boss who uses abuse language, even if it is temporary, if it repeats at a time in an interval, that is called situational. Or is this a situational problem? This can be the cause of the problem for one's distress. Not all people who have had an experience to avoid people because of their bosses or boss who use abusive language. For example, students who are anxious and timid, and unable to present in front of others. Personality problem. Is this the personality problem for this? Yes or no? This can be both situation. And this anxiety and timid personality may be the result of some circumstances in your life. Another example, let's read another example. While giving a presentation, it may be that the shock after hearing a loud sneer from the student with whom you don't get along well and may have made you even more nervous and giving a presentation, which is really distressful for you. So this is the classification according to the severity. So classification. So next lectures, I will provide for you the English schema. And also, to the extent that it does not interfere with the daily life, adaptation, and functional difficulties, and growth promoting counseling is appropriate. What is neurotic condition? Sometimes we may have neurotic conditions, right? Neurotic conditions like emotional behavior aspect, feeling significant degree of discomfort or pain in relationship or others, emotional changes, negative emotions, inappropriate behavior, depression, loss of motivation, friction, and conflict with others. These are called neurotic conditions of the problems, right? Resolving difficulties, thinking, change, and method. And the personality structure is the goal of counseling. Psychotic conditions, right? So impaired perception of the reality and based life judgments, where thoughts and behaviors needs medical attention. They all need medical attention. We have to be prepared for them. And counseling scene and format. The target of the scene or target scene of counseling, like family, and also counseling targets all parts of the family members. And when the family is unable to solve the conflict and difficulties on their own. Schooling consultation or schooling counseling. This is also, or school counseling, right? Sorry, not schooling, but school counseling or consultation is targeted for elementary, middle, or high school and university students. Academic performance, poor learning, inefficient methods, and difficulty concentrating in career, but interpersonal relationship and conflicts with the friends, seniors, parents, and teachers, and developmental difficulties, developmental into the adult's process of doing, and counseling for business and industry, stress for job performance at work. That's also one of the kind of the problems which are arising and causing difficulties or distress, difficulty in adapting to work or decreased productivity. Learning more, counseling format, how we can consult, how can we provide consultation to the clients. Most common and traditional counseling method, it is done through conversation between the counselor and the client. Most of the time, advantages, nonverbal information can be obtained. Nonverbal information. What do we mean by nonverbal information? Nonverbal information, looking at the appearance of the client, how he looks like or she looks like, how is she or he dealing with us, how they are responding to us, how their face look like, are they worried so much, do they appear worried or not, or they can be understood through nonverbal appearances. Also, telephone consultation. This is the counseling method used on telephone to communicate. For example, life's phone call or smoking cessation consultation or counseling. Advantages: guaranteed anonymity, right? Anonymity and ease. And ease of use. Ease of use. This can be very easy. Use in emergency situation. Disadvantages. What are the disadvantages? The advantages include instability of counseling relationship, limited understanding of the clients. So they both have significant advantages and also some disadvantages. And correspondence, like cyber counseling and professional in general counseling. Are you qualified? Are you qualified counselor? This is a really important point. As a qualified counselor, the person should have good behavior, being patient, good listener, and providing and focusing, providing good evidence of the case, and also solving relevantly, and systematic knowledge and systematic knowledge and counseling theories and methods, realizing the knowledge through abundant counseling practice and training, more efficient and high probability of success. The more the person is a professional, the more the better the outcomes are. And is there a systematic evaluation of the client complaints? Complaining, difficulties, and underlying causes may be separate. Being able to systematically evaluate complaints and root causes. This is the final slide of today's lecture. So what is counseling? Who is the consultant, and what is consultation? A counselor is a person who is providing enough information, good advice, or information in order, good advice for the vulnerable ones or who are in distress in order to overcome the situation from the difficulty. Thank you so much. If you have any question, please feel free to contact us. We will respond. If there is any question or confusion, please contact us. Feel free. Do not hesitate to contact us. Thank you so much.